In Washington, George Aite, president of the Free Africa Foundation and distinguished economist in residence at American University. In Regina, political scientist Tom McIntosh, co-author of the newly released report, Ethical Recruitment of Internationally Educated Health Professionals. And with us here in the studio, Queen's University law professor Sherry Aiken and Francisco Rico Martinez, director of the FCJ Refugee Center here in Toronto. And we're now going to explore the notion of, if in fact we do take the best and the brightest from countries around the world, are we, in our efforts to improve our society, hurting the countries that those folks came from? Let's start in Washington. George Aite, is the recent drive in Canada, and in the West for that matter, to hire more skilled immigrants unintentionally hurting the developing world?
Well, there might be cases where this might be so, but if you look at Africa, for example, Africa loses almost close to 4,000 qualified and skilled personnel a year, costing the continent almost nearly $4 billion a year. But then again, on Africa, it's the issue can go either way. You look at a country like Zimbabwe, where nearly 40% of the medical doctors have left the country. So in a way, people are leaving. Not necessarily because rich countries like Canada are attracting them, but they're leaving because of appalling conditions at home. They're leaving, you look at Sudan, you look at Ethiopia, the Congo, for example. So for them, they're leaving for greener pastures. So it's not necessarily true that the rich countries are poaching skilled personnel from them. So I would say that each particular region has its own different and specific reason for the brain drain.
Sherry, how about you on that?
Well, indeed, I would agree with George. I think it's dangerous to apply universalistic conclusions about this issue. There's no question that in some cases there is a problematic brain drain. In fact, it becomes so serious that it's a fatal flow, as described by the World Health Organization in a very important report last year, documenting precisely the issue of healthcare workers flowing out of certain very poor, impoverished countries in Africa. But on the other hand, I think it's important to also recognize that increasingly there's a kind of diaspora circulation, transnational networks of highly trained professionals who actually don't simply emigrate out of their countries and stay in countries like Canada, for example, but go back and forth and reinvest in relief, reconstruction, and development back home.
We think life is so fabulous here, though. It's hard for us to imagine that once they've left, some of the worst or poorest parts of Africa, that they actually want to leave here and go back there.
Yeah, but it's a question, absolutely, and it's a question of identity, of nationalism in many cases, of loyalties that don't go away overnight. And just to cite one very simple example, in the wake of the tsunami 2 years ago, more than $1 million Canadian dollars were raised by the Tamil diaspora here in Canada, primarily from Toronto and Montreal, in 3 days, and sent back to relief organizations. We're not talking individual families, but we're talking about actual NGOs receiving funds from the community back here to support relief and reconstruction initiatives. So that kind of thing is very important.
Francisco, let me read something out of Maclean's magazine that was in that magazine a couple of weeks ago on the issue of whether we're in the midst of a new brain drain. Some analysts, the magazine said, some analysts say that as many as 50,000 PhDs, or 30% of Africa's university-trained professionals, currently live and work outside the continent, in Britain, Europe, or North America. Others put the number higher at 70,000 skilled graduates leaving each year. You're from El Salvador originally.
Yes.
How bad is the situation, do you think, for Central America?
It's not that bad because nobody wants us. I mean, the technical development of the education system and whatever doesn't attract a lot of governments or states trying to pull people out of Central America. But in the other hand, if you review the problem of the international trained professionals coming to Canada or to the Western Hemisphere, the problem that I have is that there is a trade that doesn't have ethics. Because you trade a 20 years student, you invest 20 years of studies in someone, and what you take back to that country is remittances. So maybe $200 a month or whatever, then for me is a problem. And I agree with Sherry in the way that when it's a sort of an event that happened back home, the people mobilize. But that's not development. That's aid. And the problem that we have is that this situation is creating a serious problem in the ethics of development, in the ethics of the construction of the humanity as a whole, because we are still in the colonialism, stealing resources from places that are needed the most. And my problem is that we don't do anything to replace that resource. For an individual, it's good, because they move and they have better future or whatever. For the society, for the future, for the projection of that people, I don't know. I think it's a drain.
Let me go to Regina and get Tom McIntosh on this. You just finished co-authoring a report dealing with those who are internationally educated and they come to our shores and they want to be doctors or whatever here in this country. Do you like the word poaching? Does this country poach doctors from other countries?
The word poaching got used, and it got used in a number of the media reports around this report. One of the things we found, and it goes to some of the things your other guests have already talked about, is that there's actually very little now of the kind of active recruitment of that sort of going to developing countries, either showing up at job fairs, the advertising in those countries, taking place by Canadian governments in particular with regard to health professionals. We have it's a somewhat different phenomenon now. It certainly was the case. First, let me say that we did do that a lot in the past. We have ample evidence of those kinds of ad campaigns and the like. Now we have much more informal networks between existing groups of especially medical professionals in the country who are actually doing a lot of the recruitment themselves, going back to their old medical school, their old colleagues that are in their home country and encouraging them to come over. And then we also have numerous, what we describe in the report as push factors, and as one of your other guests talked about, those sometimes appalling conditions that in fact push people out. So there are different categories of immigrants, and people emigrate from their home country for a variety of reasons. But there's very little evidence of that kind of direct poaching that we saw in past decades.
I want to follow up with something Francisco just talked about, and that is this notion of remittances, where immigrants come to this country, they establish themselves in whatever line of work, and then take a portion of their pay and send it back home, directly to a family, presumably family members back in the old country. And let's bring this board up, Michael, if we can. Here's the case for remittances. Research by the World Bank in 2006 finds significant positive effects of remittances for development. These funds have reduced both the incidence and severity of poverty and have also been associated with increased household investments in education, entrepreneurship, and health. That's from the Conference Board of Canada. Francisco, that is a very positive assessment of what remittances can do for families all over the world. What's your sense of it?
Well, the remittances has to, first of all, fill the gap of hunger. If you need money to survive, if you need money to eat, if you need money to dress, you are going to use the money that is received to do that. That's why in different regions, we have a phantom economies that they don't produce now any longer, because they are expecting the money for coming from somewhere, particularly from the United States. And the other thing that is very clear is that that money is not used for development. You know what I mean? We have to...
Well, it says here it is.
Yes, but I want to see the numbers. Because one is the intention, one is the how you try to sell that we are doing this and, oh, look, they are receiving hundreds of millions. It's true, but they are not used for the development of that particular country.
You say you want to see some numbers? Sherry, hold that thought. I'm going to get you to comment on this. Here are, let's bring this up, Michael, remittances to the developing world. This is in U.S. dollars. And look at this. You want to talk billions. In the year 2000, $85 billion was being sent back in remittances, so-called, to the developing world. In 2003, it had jumped to $145 billion. The 2006 estimate is nearly $200 billion. Is there any bad news to be had here?
Well, I mean, I think that we need to nuance that news. I think we need to, first of all, appreciate that remittances are far more important to local economies in the Global South than development assistance. And that's probably unfortunate because it speaks to the vacuum in terms of official development assistance and where it falls down. I think it's also important to nuance these statistics in terms of differential effects. there's a real absence of solid empirical evidence on the effects of remittances. So Francisco speaking about his experience in one particular region of the world where he sees that, in fact, there hasn't been a great deal of development. On the other hand, we've got other regions where there's clear evidence of development activities taking place. I mean, I don't need to just talk about tsunami efforts in Sri Lanka. I could talk about home village associations formed here in Canada that send money back to build hospitals, orphanages, schools, etc. You know, very concrete development initiatives, often in contexts where governments are not able to step in themselves in the South. But I think the whole point here is there's money going back and forth. There's a real need to evaluate critically on a case-by-case basis what the effect of it is. And I think we've been speaking far too much in generalities, the World Bank included.
Well, let me get specific with George Aite. Can you give us a sense of how important it is to the economies of various African countries for former citizens of those countries now living in, say, America or in Canada, sending remittances back home?
Well, I agree that, you know, the issue needs to be, remittances needs to be nuanced a bit. In Africa, for example, Africans in the diaspora send back something like $35 billion. That's what the IMF says. But the problem with that is a lot of that money is sent home for consumption purposes, not for investment. I think what Francisco wanted to mean was the remittances weren't being used for investment. And that I will agree. But the Africans in the diaspora do more than just sending back remittances. Number one, you know, if you take a country like Ghana, when after democracy was established, a lot of the Ghanaians went back home. So those who are abroad, the immigrants, they are also a force for, let's say, political and economic change at home, in the sense that they help organize opposition forces, they fund opposition activities. So they're not just, you know, sending money back home. They're also very much involved in political activity.
Francisco, I want to show you some more numbers here and then get you to comment. And we should remind everybody here, the numbers we just put up there, those billions and billions of dollars, those are official numbers. Those aren't, you know, those don't include the unofficial numbers, which might be another 50% higher beyond that. But let's show remittances as a share of the gross domestic product of a few countries around the world. Look how Haiti depends on remittances from their citizens who have gone abroad. Fully a quarter of the Haitian economy depends on remittances. How about in El Salvador? That's Francisco's country of origin, 16.2%. In the Philippines, 13.5%. Morocco, 8.4%. And Bangladesh, 5.9%. It would appear as if the dependence that these countries have on, you know, their family members who've gone to the so-called New World is hugely significant, is it not?
The dependency is huge and is growing, and growing in a way that for me was amazing to know that now El Salvador, for instance, has a matching program. When if you send money to a community, the government match the investment than the people outside us. But you know what they do? They ask money from the World Bank. And now the government has to pay interest in the matching system. So we are creating more debt and debt internationally to use the remittances than the people is sending. So the solution is, I think, I totally agree that it's by region. But in the other hand, the problem that we have here is corruption. Nobody talks about that these remittances are used in the way that, to develop that particular communities. We have corruption, we have people stealing money, and we have the government in that particular country using that particular resource in a way that is not for the society in particular.
I want to make sure I understand what you're saying, because one of the arguments I've heard against increasing foreign aid is that too much of that foreign aid ends up in the pockets of corrupt governments or corrupt dictators, whatever, whereas remittances are a family-to-family transaction, and therefore the money actually does get to where it needs to go to.
Yes.
Is that not right?
Family-to-family, yes, to pay for food, to pay for clothes. That's not development. That's creating dependency. And what we have to stop is that, and we have to have a better approach in general terms to create programs that are going to develop the particular areas, education, name it. You know what I mean? Everything that we are removing from there, bringing an engineer or bringing a doctor from there to this country.
Okay. Sherry, and then Tom, I want to hear from you on it too.
My point would be that there's no question Canada's development policies, and indeed the North's development policies, are seriously lacking. There's a lack of effective planning. There's a lack of effective implementation. and we need to do much better. Certainly in Canada, our development assistance has been falling seriously behind over the last decade. And that's an important issue all by itself. And I think it's dangerous to really link very directly development initiatives in the North on the one hand and immigration policy on the other. There's no doubt there's some connections, and it's important to look at them, and it's important to look specifically at how Canada should promote a fairer immigration policy in terms of global justice issues. But I also think, the issues that Francisco is speaking about have to do squarely with our development policies and what's wrong with them, and we need to address that.
Tom, you got a view on this?
Well, one of the things, the interesting thing with the health professionals that we looked at is with medical professionals, that is physicians, you don't see high levels of remittances going back, at least not with many of the communities.
Why is that?
Well, especially in the case of Canada, we've taken huge numbers of doctors, or huge numbers of doctors have come from Southern Africa, and they come with their entire families. And so those personal remittances...
there's nobody back home to send the money to.
There's no one. They've brought their family with them.
Gotcha.
Where we do see it is, oddly enough, in the nursing profession, which is still predominantly female, where you actually see people leaving their families, coming to developed nations to take nursing jobs and sending funds back home. And it's gotten to the point where, in fact, some developing countries appear to be producing or educating far more nurses than they can possibly absorb into their own healthcare systems, with the expectation, in fact, that these people will emigrate and send remittances back to their families. It just strikes me as a somewhat twisted and ineffective development strategy on the part of developing countries.
Well, I don't want to blow everybody away with too many numbers here. However, we have been discussing this notion of what gets the money to the people who need it the most, remittances or official aid through a government. And let's bring up one more chart here, Michael, where we, again, source the World Bank. Look at the blue line on the bottom. That's official development assistance, government to government. And you can see the number is smaller and has not increased as much, according to the World Bank, as recorded remittances. This is only recorded. Remember, we talked about half of this going on as well, not recorded. And the recorded remittances back home are higher, and the line is trending higher at a greater angle as well.
And that's a problem.
Now, tell me why that's a problem.
Because we should be doing more for development assistance, and not, by the way, just bilateral development assistance in terms of government-to-government assistance, but government here in Canada to NGOs who can do the work at a grassroots level in countries in the global south. And as I said, the numbers are falling way down. That's bad. And we can't hope to achieve through remittances what needs to be done through a coordinated development strategy.
Well, actually, I want to know if that's the case. George, give me your view on that.
Well, I thought that Canada was one of the very, very few countries which allocated nearly 13% of its official development assistance to NGOs. But the NGOs, I'm afraid that I must say, were Western-based NGOs, which were based in Canada, but not in the recipient countries. And I think I'll agree with Shirley's point that much more aid needs to be channeled to those NGOs which are based in the recipient countries.
And listen, one of the problems that we have is that in Central America, for instance, you see this curve going up in remittances is because the prices of things back home are so high now. You, in order to buy a piece of land, you have to spend $100,000 now in El Salvador, in a small village, very, hiding and whatever. Why? Because now everything is American dollars in that particular country. Remittances is pushing all the prices up as well. So, and
having
every time,
inflationary effect?
Inflation, and you need more money every time in order to survive, in order to develop. So the things that you are seeing there is basically the phenomenon of a phantom economy.
Okay, but surely the response to that is not for people here to send less money back home. You wouldn't want that to happen.
Is to have a development programs and to have more aids and to try to do a structural investment and to do an investment in education and in different areas that we don't talk about. That money doesn't go to education.
And at the same time, when we evaluate our immigration policies here at home, we need to have a wider lens. we need to consider what the effects of our immigration policies are, not just for Canada, but the rest of the world as well. I think there's no doubt about it. Ratna mentioned in the earlier part of the program, that the current skilled worker recruitment program is fairly new. It's difficult to tell how it's working. Well, I would suggest it's high time the government started monitoring how it's working.
The ethics.
That's absolutely critical.
But I don't want to...
I'd like to jump in here.
Please, go ahead, George.
I'd like to jump in here and, indicate to Francisco that we also have exactly the same problem with remittances to Africa. So a group of Africans, including myself, what we're trying to do is to mobilize the Africans in the diaspora who are here so that they can mobilize funds from them for investment in Africa. This way, make sure that the remittances that get to Africa is not consumed, but actually invested in some productive economic activities.
George, as long as you've got the floor, I want to read you something that Reuters news agency published a couple of months ago, towards the end of 2006. And it talked about the crumbling universities on the continent of Africa. And here's how it goes. From Nigeria and Ivory Coast to Kenya and Uganda, crumbling faculties and campuses, overcrowded lecture halls and hostels, and depleted libraries and laboratories bear sad witness to chronic shortages of funding and investment. And the prospect of better salaries abroad is luring away talented teaching staff and dragging down the academic standards of the continent's once renowned alma maters. I, again, want to get back to this question of whether or not by hiring the best and the brightest that come out of Africa, we are in some respects dooming the institutions that these men and women have left. What do you think, George?
Well, this is really a tough one. I see, as the story says, there has been complete neglect of Africa's top educational institutions. As a matter of fact, last year, Bill Gates and the Ford Foundation announced that they were going to send a $200 million lifeline to save Africa's top universities. If you take a university like Makerere University, for example, it used to be called the Harvard of Africa. Today it's in complete shambles. And it is not just the universities, the universities which have been in shambles, but also Africa's modern healthcare system has completely collapsed. Collapsed in the sense that about 80% of Africans now rely on traditional medicine. Which means that, it's very hard. I know there are some African doctors who are, doing the best that they can under tremendous, odds to try and stay at home and help their patients. But the conditions there are just, in some of these hospitals and also some of the universities in Africa are barely tolerable. And that's why they leave. So, all right, in order to make them stay, I think a lot more has to be done. In fact, the push factors from home also need to be addressed, and not just the pull factors alone from the rich countries.
Tom, you studied all of this. I want to know whether or not you share the view that by taking in more doctors from other parts of the world, we're helping to doom their own healthcare systems.
Well, it's certainly clear that we know that the number of doctors, especially from Southern Africa, who have left for a whole variety of reasons, have done significant damage to the healthcare systems in that part of the world. One of the interesting phenomena that we see, and one of the supposed solutions for this, has been to use foreign aid dollars to bring Africans or people from other developing countries to Canada to study in the expectation that they will then go home. Of course, what that does is our foreign aid dollars then wind up getting spent back in Canada rather than in those developing countries. And we actually wind up, in some ways, exacerbating the problem, because as we have a situation going on right now with some Libyan medical students who don't want to go home, significant numbers of those people don't want to leave the developed country where they were educated, or they find when they do go back that they're in fact not properly trained. They're trained in a model of medicine that doesn't exist in many developing countries. They get frustrated with their inability to practice the way they were trained, and so they then emigrate back to the developed world.
Well, let me try this with
Sherry.
So
we've not actually used that money to build the medical teaching infrastructure in the developing world, where it would be, I think, be put to better use.
Okay, Tom, let me ask this then of Sherry. Is it a more ethical position for us to take then to say we're going to cut off the numbers of doctors who can come from, let's say we're talking about the south of Africa right now, we're going to dramatically restrict the numbers of doctors that can come to Canada from that part of the world because we don't want to see their healthcare system deteriorate any further.
I don't think that's the right response. I do think we need to respond to the problem, and I think we're all at item that there is a problem of varying degrees in different regions and different contexts. But I would like to see us address the serious healthcare problems in African countries, for example, with more effective development assistance rather than cutting off the opportunities to move. At the end of the day, the decision to emigrate is a personal one, and one I think that it should involve personal autonomy. And the notion that we should somehow prohibit a whole class of individuals from particular countries from moving, to me, is a violation of fundamental rights of mobility. I don't want to see that. I want us, on the other hand, to think about the ethical responsibility involved when we recruit those professionals. What do we have to do to compensate? What do we have to do to address the serious vacuum we're leaving?
And the answer, in your view, is to increase our
development
aid
assistance. Absolutely.
There. Francisco, your view on this?
I totally agree with Sherry. Will be totally unacceptable for me to be against the dreams of someone to come to Canada and to live here. But in the other hand, I have to materialize the dreams of that child that is back at home, that doesn't have any way to come here. And I think Immigration Canada has to also flexibilize the criteria, because now there is so classist, so educational dream-oriented, than the people that are poor, that are really needed to come to Canada to work, to do cleaning and whatever, doesn't have the possibility to do it. And they have to use the illegal ways to come to Canada because our government doesn't develop policies that are appropriate to take that people that also need to migrate.
If there's one thing we have always been able to depend on you for, Francisco, it is the utopian view. And that's you express that so ably every time you're on this program. And you've done it again today.
Thank you.
How do we, George, come on in here. How do we strike the balance between trying to help ourselves and yet help the developing world at the same time?
Well, I think I will agree with Sherry's point that, as I indicated, and as we all know, let's say in Africa, for example, the educational system has simply collapsed, and the healthcare system has also collapsed. Now, all right, Sherry suggests maybe we should increase our foreign aid program to help rebuild these institutions or systems in Africa. And, all right, well, I would say that we'll go halfway in solving the problem. The real problem that we've had in Africa, especially under military regimes, I think, Africa's military regimes just showed utter contempt for top-level educational institutions because they didn't support university education because they were afraid that university educations would teach people about their political rights and they would demand democracy and so forth. So they starved the universities of funds. This happened in Nigeria, it happened in Ghana, and many of the West African countries. So Sherry's suggestion really begs the question about the type of governments that we have in Africa. So ultimately, it will require improved governance in many of these African countries. Now, back at home, it's literally impossible in many African countries to effect change. And this is why some of the immigrants who are here, let's say in the U.S. or Canada, quite often, help bring about change. I can speak to my own personal experience that I was safely in the U.S., but I was working very actively with the opposition forces in Ghana, and we were able to establish democratic change in 2000. So the welcome that Canada, I spent some time in Canada. The welcome that Canada gave me also helped me indirectly in effecting political change in my own country. And
in exchange for the pleasure of having you be influenced by Canada, did we increase our foreign aid to Ghana? Was it a good trade?
Well, I will say that Ghana had indirectly benefited from the scholarship that they gave me back in the 1980s. So in a way, and I think, the issue that we're discussing tonight is a very tough one. And sometimes, although Canada is welcoming immigrants, and, the case could be made that, perhaps, Canadians should let more immigrants in. But there are other benefits which flow the other way. And quite often, these benefits are not, well accounted for.
But the aid of Canada is not for improving governance in the global south.
No.
You have to use it in material things. You know what I mean? I totally agree with George, but the problem is that they told you, no. For democracy, no. For education, for governance, no. So in that case, you are stuck with the idea of development that is so behind our times that we have to review the concept that we have to help that people also in the global south.
Yeah, a key question is not so much development, but what kind of development.
Exactly.
And the critical focus on human rights, I think, has been missing in so much of development policies.
Tom, I want to read a little piece from your study, okay?
Okay.
Here's from Tom McIntosh's study. Reducing the reliance on IEHPs, internationally educated health professionals, from developing countries will begin with the recognition that Canada, at both the federal and provincial level, needs to take seriously the commitments it has made to the Canadian public to achieve a greater level of domestic self-sufficiency in health human resources. We have been hearing, for years and years about how people get their degrees in other countries around the world. They become doctors there. They come over here. They're driving taxis here. They're not practicing medicine. They're doing all sorts of things. Tom, I want to find out from you, though, I know there's a doctor shortage in many places around Ontario. An hour outside Toronto, people can't get a doctor.
It's not just in Ontario.
Sorry?
It's not just in Ontario.
Of course. How badly do we need these professionals, and how much of this is just poor planning on the part of our people over here?
Well, one of the key points, I think, in our study is that the resulting shortages that we have in Canada, and especially in small towns and in rural parts of the country, stem, at least in some part, to policy choices that Canadian governments made over the past couple of decades around their health human resource planning. And that the curtailment of medical school enrollments about a decade and a half ago is part of that. That was one of the choices we made because we thought there was going to be a surplus of doctors. It turns out, in fact, we were woefully wrong on that. We also have, as we've talked about, the case of people with some degree of medical training and all the way from lower level medical or health professionals up through physicians who are not being able to get their skills assessed and to get credentialed in a timely fashion. And the problem, of course, is that the longer they are away from the practice of their profession, the more their skills atrophy and the longer their road to certification in Canada is. Harnessing and investing in those people who are already here would go at least a part of the way to helping alleviate some of those shortages that we have.
But Sherry, we hear this all the time in our society. You can't walk and chew gum at the same time, right? Governments, institutions, they have to make priorities. Should the priority be, since there's a finite amount of energy to go around, should it be to try to get accreditation for these foreign-born, internationally educated health professionals, or should it be on the unskilled workers, which we have a crying need for as well?
Well, actually, I think you've hit on a very important point. Our current skilled worker program is terribly skewed in favor of the knowledge economy, quote unquote, in favor of highly skilled professionals, people with multiple university degrees. And that's based on a premise that I think could be deconstructed quite usefully. I would like to see a better balance in our skilled worker immigration program and recruitment of both skilled and less skilled workers. And I think right now we see lots of problems in the system because of the way the program's skewed. Professionals are being brought to Canada finding huge barriers to accessing their chosen professions. And at the same time, as Francisco mentioned, all kinds of people are denied the opportunity of coming to Canada. And those are people that we could also use in Canada to benefit the economy. In many cases, there are chronic labor shortages that aren't being addressed.
Ironically enough, Francisco, is the uneducated laborer from El Salvador who finds his way up here in a better position to make a living at whatever he wants to than the former engineer or physicist or doctor from another country?
How you know that they are not engineers? How they have to lie to the Canadian program. Engineers, doctors, they said, no, I am not educated, in order that they come and they are hired to to raise pigs in a farm. Because if they mention the diploma, they are not hired for that particular position. That's the double standard that we have in our system. You know what I mean? And so you are bringing engineers to raise pigs.
Unknowingly.
Unknowingly, because the people is forced to lie. And then we said, you lied to us. And you accuse them of lying, and you know what I mean, and you know the rest. So this is an unmoral situation. The ethics of this problem has to be studied. That's my concern. We are continue discussing, but the moral and ethics of this issue, development, migration, is not on the table.
Tom, I got about a minute left here. Can you tell me this? Most politicians I talk to say that the commitment that they and their governments are making today to make sure that foreign-trained health professionals get a shot at doing that occupation in this country has never been stronger. There's a real push and a real commitment to making it happen right now. Do you agree that that's the case?
I will give governments credit for, in fact, doing much better now than we have in the past. So, yes, it's never been stronger. It was never very good in the first place. So we still have a long ways to go in that regard. But I think governments do need to get at least a bit of credit for having made some progress in the last couple of years.
Okay. We don't have a long way to go. We're actually plumb out of time right now. We're done. I want to thank everybody for being on the program tonight. Tom McIntosh out of Regina, good to have you on the line.
Thank you
George
very much.
Aite from Washington, thanks so much for being there. George, good to see you again. And Francisco and Sherry here in Toronto.
Thank you.
Glad you could be with us tonight as well.
Thank you.